Hi, Dr. Lou from Beach Cities Laser Vision. We're excited for your procedure day. When you come in, you'll be checking in like usual, and you'll be given written post-op directions and some Tylenol and an NSAID to take off the edge of any light discomfort that you might have during the procedure or afterwards. We'll walk you back to the lounge area, and we'll make sure all your last-minute questions are answered. However, do try to read your consent and pre- and post-op instructions at least a few days prior to your procedure day, so that any last-minute questions are answered beforehand to minimize any surprises on the actual day itself. We will repeat all these instructions right before the procedure and during the procedure again, so you don't need to think or remember anything for the 10 minutes in the procedure room. We'll also provide anti-anxiety medication if you'd like. The easiest mental approach is to just zone out, listen to my deep soothing voice, and if you have any particular music that you want to listen to, we can play that in the background, and just focus on your breathing and just gaze off into the distance. We'll bring you in, get you situated on the bed as comfortable as possible, and we'll also give you a very fashionable hairnet. If you do have longer hair, try to leave it down or in a very loose, low ponytail so that it doesn't push your head up. You can expect to feel some things during the procedure, but no pain or significant discomfort. We do give you lots of eye drops, including numbing drops to minimize your blink reflexes. While the eye surface itself is numb, we can't numb your eyelids or eye socket, so it is normal to feel some tickling and some pressure. Once you get situated, we'll give you eye drops to help you get used to the feeling of not reacting when things are around or touching your eyes. There'll be a lid supporter to help you open your first eye. The more relaxed you are, the less you'll feel. You'll hear me telling you to try to open both eyes, even though we did tape close the other eye to prevent it from drying out. There'll be a green light for you to look at for just a few seconds. And then you'll feel a little bit of pressure, and then it'll be very important for you to just stare straight for 23 seconds. There'll be a white fog that comes in, and you'll probably feel a little bit of pressure or nothing during this time. The green light will disappear during that 23 seconds, but try to just keep looking straight. Try not to follow the green light or squeeze your eyes, and we'll count down for you. After that part, it will be very blurry and white. If you need a break during any other time except for that 23 seconds, you can talk, and we can give you a break or more numbing drops if needed. On the very rare occasion, if you do move significantly during that 23 seconds, we can switch the procedure over to LASIK, and you can continue to do well. After that 23 seconds, there will be a couple of minutes of some strange massage-like sensations where we're wiping those bubbles out of the way, and then we'll do the same thing for the second eye. The second eye will often feel different from the first eye. That's just the way the brain processes things. Nothing wrong or different is happening for the second eye. And then we're done. When you sit up, you'll probably notice that the first eye is already better than the second eye. After about 10 minutes, the numbing drops will start to wear off, and the eyes will feel quite stingy, like there's an onion next to it. So not pleasant, but not unbearable. The relaxing medication can help you sleep through that initial discomfort. So go home, take your eye drops and the relaxing medication. When you wake up, most people feel like there's a dry contact or a little eyelash in there, but overall, very tolerable for most patients. It's normal for one eye to feel slightly better than the other one. As long as they're about the same, that's normal. If you have any questions at all, always feel free to reach out, text, call, email, just like you've been doing. And anything else that the video hasn't answered, we're available. Don't forget to breathe. We're going to take great care of you. Really excited for you, and see you soon.